little bit of background to this work. The last time that we looked at the supervision of domestic abuse perpetrators by the probation service was 5 years ago in 2018, and that thematic focused on the work of the private sector community rehabilitation companies who at that point were responsible for supervising low and medium risk offenders. We had some quite serious concerns about the quality of that work 5 years ago and made a number of recommendations. Lots has happened since then, so this felt like a good time to be going back and looking at the work of probation with this group of people on probation. Two key events, obviously, over the last 5 years have been the COVID pandemic and the unification of probation services back into the public sector in 2021. Both of those have had quite profound and major impacts on the service, and Noreen will be talking a bit about that. But this thematic looks at the work of the unified probation service with this group of people on probation. What hasn't changed, sadly, over the last 5 years is the prevalence of domestic abuse. There are over 1.5 million domestic abuse incidents reported to the police each year, and that included in the year ending March 2022, 134 domestic homicides, including homicides committed by people who were on probation. One of the most high profile of those was that involving Damien Bendel, who murdered Terry Harris and 3 children at her home in Derbyshire in the autumn of 2021. And we published an independent review of that case in January of this year, which revealed failings both in terms of individual practice, but some more systematic failings as well in terms of the way that the probation service assesses and manages the risks of domestic abuse amongst its caseload. We also find evidence of domestic abuse risks in the serious further offence reviews that we quality assure. 2/3 of those reviews we find involve someone who is known to present a risk of domestic abuse. So a huge and important issue. Next slide. Just finally, to give you some idea of the scale of the cohort that we're talking about. Currently, about 240,000 people are managed by the probation service, either in custody or in the community. And the probation service's own case management system flags about just over 30% of those as being either current or previous known perpetrators of domestic abuse. And that equates to almost 75,000 people on probation. As you'll hear later in this presentation, those people can be a risk over several years, and they can involve also multiple victims over the years. So it's essential that probation service gets the assessment and management of this cohort of people right. Final point to make before we hand over to Noreen is the profound challenges that the probation service has had around staffing in recent years. Current figures show that almost 30% of probation officer posts, for example, are vacant, and that number is higher in London and the southeast, and that is often severely restricting the quality of the work that the service can do with everyone on its caseloads. It's restricting the amount of face-to-face contact that people get. It's restricting home visits. It's making it difficult to deliver interventions. 2 out of the 6 areas that we visited during the fieldwork for this thematic were operating in what's called the red prioritisation rating, which meant that they had less than 60% of the staff that they were supposed to have in post. But more on that from Noreen as we move on. So Noreen, handing over to you. You're going to tell us a bit about the methodology for this thematic.
Thanks so much, Justin. Yeah, thanks, and thanks to everybody for joining the event. It's good to see such strong interest in this work and this topic. Obviously, we're going to highlight the main findings from the report, but there's lots of other content that's in the report that we won't have time to cover today. So a shameless plug at the start to read the whole thing, and I'll probably do the same at the end again. But to explain how we approach this, if we could have the next slide, please. So this covers our methodology. So the first thing that we did was we looked at the data that we already had through our core inspection program. So we've just now completed inspections in each of the probation regions. At the time we did this fieldwork, we were part way through that, but we looked at the data we already had, and we were able to extract from all of the cases we inspect those that had a domestic abuse concern and look at what that data was telling us. That was the first thing that we did to learn about what's going on in each of the probation delivery units we've been to. And then our fieldwork samples, sorry, I should say that core inspection data at the time was about 1,200 people that we looked at, and 40% of those had a concern in relation to domestic abuse. So that's quite a large number of cases that we looked at there. And then our fieldwork, we had two samples that we looked at during the fieldwork. The first consisted of 60 people who were subject to a community order, suspended sentence order, or a prison licence, who were identified as currently or having previously posed a risk of domestic abuse. For those cases, we completed a full inspection of the case. We looked at all aspects of the assessment, planning, sentence delivery and reviewing activity. And where possible, we spoke to the probation practitioner responsible for the case. Some practitioners have more than one case in the sample, but we spoke to a total of 45 practitioners across the 6 weeks. In our second sample, we did a shorter inspection. Sorry, there's some background noise. I'm not sure if somebody's not on mute. So our second sample, we looked at 83 cases, and these were cases that the probation service identified had commenced a domestic abuse intervention. On the whole, this was BBR, the Building Better Relationships Accredited Programme. And what we wanted to look at through this sample was to understand whether people who were expected to complete an intervention, firstly, did they have the opportunity to do so? And if they started on the programme, were they able to complete it? And if not, what were the reasons for that? We also had a second strand of interest with these cases, which we were supported in understanding by our colleagues in the police inspector at HMIC. What we wanted to know was where people were on an intervention, how often they then came to light for further domestic abuse incidents, either whilst they were on the programme or when they'd completed it. So, and whether, if they had come to the attention of the police, were probation always made aware of that. So that was the nature of our second sample. So we looked at the police intelligence records on those cases as well to understand if there had been further incidents and the information flow around that. And in each fieldwork area, we had a range of meetings with probation practitioners, programme facilitators, managers, leaders, and operational and strategic partners. So that often included police, children's social care, other third sector organisations who are working in the domestic abuse space. And at the end of the 6 fieldwork weeks, we had a week of interviews with the national leads for domestic abuse within HMPPS, so those responsible for the policy and strategy. So that's our methodology in brief. If we can move on to the next slide. So what this slide is showing you is an overview of the characteristics of the people in our main sample. So in those 60 cases that we looked at in depth. This sample included those where domestic abuse was the index offence, so the reason that they were with probation, and those where they were on an order or a licence for other reasons, but nevertheless they had domestic abuse registrations attached to their case records. So they may well be on an order or licence for an entirely different matter, but nonetheless there's known to be a domestic abuse concern. The sample included cases where the abuse was against a family member. That was a smaller element of the sample, but we didn't just look at intimate partner violence. We did look at familial abuse also. The proportion of cases that had a domestic abuse perpetrator or history registration attached to their record varied quite significantly across the PDUs that we visited. So I think the lowest we saw was that 18% of their overall caseload had a domestic abuse concern, and then the highest was 38%. So quite a variation there. We know that there have been concerns raised previously through internal probation audits about the accurate identification of domestic abuse perpetrators. So we didn't focus on that too heavily, but safe to say we knew that there was some improvement work going on around that already to make sure that all cases where there was a concern were accurately identified. Next slide, please. So the next slide just again gives some more detail about the characteristics of those in our sample. So what this slide is showing you is of the 60 cases that we looked at, how many victims we could identify that those people had been responsible for creating. So you can see that for 3 people in the sample, for example, they had 6 or more victims, and then on the second chart there, the number of years that those people had domestic abuse as a concern in their lives, and you can see that for 10 people they had a concern about domestic abuse for 10 or more years. So quite a range of length of domestic abuse being an issue. Next slide. So moving on to what we found out. So as Justin said, the last time we looked at this topic was 2018, and we looked at the work then primarily of the community rehabilitation companies who were delivering programmes and managing low and medium risk cases at that point. That inspection identified a concern that at that time there was no overarching strategy for domestic abuse or for tackling domestic abuse. So in this inspection, we found certainly that there have been some improvements in aspects of leadership, although still room for improvement and more that needed to be done. So we found that there's now a domestic abuse policy framework which provides a comprehensive set of guidance for those working with domestic abuse, and links practitioners or other staff in with all of the relevant policies and procedures. Disappointingly, though, what we found that in practice, very few people knew about this framework or were actively using it to inform their work, and therefore the guidance, despite being comprehensive, wasn't having the impact that it was intended to have. There's a National Domestic Abuse Reference Group, so referred to often as NDARG. So this exists to improve domestic abuse practice by identifying key priorities, establishing best practice and promoting consistency. The group's well attended, it's an active group, it meets regularly, and it brings together those who have responsibility for policy and those responsible for operational delivery. So it's a good opportunity for those 2 groups to come together. The group's had some successes, so it has made positive improvements at driving increased completion of the Spousal Assault Risk Assessment, or SARA, which is the specialist domestic abuse assessment tool. And the group's currently commissioning a dashboard which will allow access to a range of related domestic abuse related data to be accessed clearly and to see a snapshot of how things are. However, there's still no specific domestic abuse strategy for the probation service, and we felt that having a strategy of that type would allow a clearer focus on domestic abuse for the service and a mechanism against which to test some of the progress that's being made. With domestic abuse cases, information sharing with police, children's social care and other organisations is an essential part of good quality probation work. In relation to the police, there is a National Information Sharing Agreement, an ISA, as it's referred to. This is in place and it stresses the importance of sharing information. The spirit of the agreement is absolutely sound and it tries to drive practice in the right direction. However, the kind of basic agreement level, if you like, does leave some gaps. So if police forces can reject inquiries from the probation service if there isn't a known history of violence, so that can still leave some people that are coming to court for non-violent offences and have no known history. If probation ask for an inquiry on those people, it can be refused, which could still mean that domestic abuse history remains hidden and the practitioner doesn't become aware of it. Most forces deliver over and above what's in the National Information Sharing Agreement, but some forces, and notably the Metropolitan Police Service, work to the agreement, which does mean that probation staff in London do have some blockers to getting information that we believe that they absolutely need. That said, we know that that information sharing agreement is being reviewed at the moment, and hopefully that will close that loophole and make sure that probation practitioners can get information. In contrast, we did find some probation areas that had highly effective local arrangements, some where probation staff are alerted, where people on probation come to police attention, and we've highlighted those in our effective practice guide, and more of that later. Information sharing with children and children's social care services always requires arrangements to be made at a local community to negotiate that. And we found that there were some problems with a number of these local arrangements. Where multi-agency safeguarding hubs or MASH arrangements are in place, we found that the quality of information sharing tended to be better, but not without problems still. And there was still room for improvement even in those areas. But in many cases, it was very difficult to see effective information sharing between probation and children's social care, and we will again come back to that a little bit later. In looking at the interventions that are available now, we found that there's a fairly flexible range of domestic abuse interventions available through the accredited programme Building Better Relationships, or BBR as it's often referred to. There's then the lower intensity structured interventions that again are a group work offer, and then there is a one-to-one toolkit, the Skills for a Relationship toolkit. So it's a clearer set of interventions than perhaps we found previously, where I think we had some concerns about the underlying evidence base of some of the interventions. Things have been rationalised to some extent, and they share an evidence base now, so that feels clearer. The effective proposal framework, so this is a tool that practitioners use at the sentencing point, and also when people are being released on licence. So that's a tool to help practitioners consider what interventions might be available and ensure some consistency about the way that's done. So that's a positive improvement. However, we found problems at a national level in that we weren't able to ascertain a fundamental question that we wanted an answer to, which was what proportion of people who are given a requirement to complete BBR or other programmes are actually given the opportunity to do so, and of these, how many go on to complete them. And I'll share with you later some of the data that we found around that, but that was a big question that just couldn't be answered for us at a national level. Similarly, for the structured interventions, we didn't find any evidence that there'd been any national analysis completed to understand what proportion of cases should be receiving the structured interventions or the toolkit, for example, to understand what the delivery volume should look like. With the Skills for Relationship one-to-one toolkit, we found that many practitioners just weren't confident in delivering the intervention, and were quite confused about the recording practices. So that made it very hard to understand exactly what had or hadn't taken place. So next slide, please. Thank you. So through this inspection, we wanted to understand how well staff were enabled to deliver good quality work in relation to domestic abuse. And as Justin's already mentioned, a key issue that clearly impacts on the quality of this work is the workload that staff have. So for 19 out of the 45 practitioners we interviewed, their workload was in excess of 131%, according to the Probation Service Workload Management Tool, and some were far in excess of that. I think we saw figures up to 180 or more % on the Workload Management Tool. So this means that these practitioners are clearly overstretched. They're not able to complete all of the activity that would be expected of them with their cases, or that they themselves would wish to complete or undertake. We talked to practitioners about the training that they've received, and almost all told us that they felt they'd had sufficient domestic abuse training to work effectively with cases of this nature. Our casework inspection results showed that this wasn't apparent in too many cases. We found that practitioners have very little contact with any specialist services, so they weren't benefiting from the expertise or breadth of knowledge that exists in the domestic abuse space. Too often they had quite a narrow understanding of domestic abuse, which didn't take into account the really complex factors that people have or fully consider who may be at risk from perpetrators. And again, we'll talk about that a bit more. The majority of the practitioners we spoke to have been trained to use the spousal assault risk assessment, the SARA tool, which is a key tool in determining suitability for interventions. However, 20 of the practitioners we spoke to said the training was not very useful, and 2 said not at all useful, which does give us some rise to concern about how well that assessment is being used or correctly applied. In our case inspection work, we found that SARA is often completed, but the quality isn't always particularly good, and often adds very little to the assessment of the individual as a result. Recent changes in legislation through the Domestic Abuse Act, which came into force in 2021, mean that children affected by domestic abuse should now be considered as victims in their own right, even where they have not directly witnessed abuse, but nevertheless may be living in a household with adults who are impacted by domestic abuse. We found that few practitioners have been made aware of this or had been briefed about it in detail, and therefore that aspect of the work wasn't seen in the cases. They weren't thinking about children always as victims in their own right. We asked practitioners about the support they receive from managers in relation to domestic abuse work, and most felt that they had sufficient support and oversight, although some felt that supervision was quite process driven and therefore didn't create an atmosphere or an opportunity where they were able to reflect and consider the emotional labour of completing this type of work. So there's a quote there on screen from one practitioner who was talking about the fact that often it's about checking that they've completed certain tasks. It felt quite tick boxy, and they said it doesn't make me feel safe. I always feel like I've missed something. So expressing that if they were feeling that they wanted to talk about the impact this work was having on them as a practitioner, they didn't always feel able to do that. Next slide, please. So moving on to our casework, so starting off with the practice that we saw in assessing cases. So overall, we found that only 28% had a sufficient assessment of the domestic abuse issues in the case. And the themes that led us to this finding included that cases did not always have the spousal assault risk assessment completed. Less than half of the assessments that we looked at used all of the available information about the person to inform the assessment. So, for example, details about previous behaviours, previous offending, previous experience on supervision with the probation service weren't always used. And in too many cases, we found that potential adult or child victims had not been sufficiently considered. So there were people that we felt were potentially at risk from the individual that hadn't been considered in the assessment. In relation to planning, we found that plans sufficiently addressed the risks of domestic abuse in 37% of cases. Approximately three quarters of cases, planning set out restrictions and measures to protect victims. So, for example, if there was a restraining order, that was included. But only just over half of the plans that we saw included constructive activities to address domestic abuse. So much more common that we would see restrictions, licence conditions that stop people entering a particular area or contacting a particular person. But we didn't always see the constructive activity that should be being deployed to address the issues of domestic abuse with that person to help them rehabilitate and move on from their offending. Contingency planning was quite often weak. We didn't see actions to mitigate the risks that may foreseeably arise in the case. So we've spoken about this in a number of our inspections, that contingency plans are often quite generic and don't address the actual risks that the individual in the case poses. Following assessment and planning, we considered how well sentences were delivered, and overall we found that in 27% of cases the delivery effectively addressed domestic abuse issues. And the issues that contributed to this finding included cases not being seen regularly enough, or appointments simply lacking meaning and had insufficient focus on domestic abuse. 40% of the cases that we looked at had received a home visit where we felt that they should have one. Positively, we found that 71% of the cases we looked at were being supported with a range of other needs, including housing, mental health, employment, finances and substance misuse issues, which of course all could have a bearing on the reduction of domestic abuse risks also. But we saw more focus on other issues rather than domestic abuse itself. We found significant room for improvement with reviewing practices. So we identified that only 23% of the cases that we looked at had adequate reviews to address the domestic abuse issues in the case. And themes here included a lack of any apparent reviewing activity at all. Half of the cases we inspected had not had a review of their risk of harm classification to take into account any changes in their life or emerging issues that either increases in risk or things that may reduce their risk. 6 cases that had their risk level changed, but we couldn't see any apparent rationale for this. We didn't know why that change had been made. And 45% of the cases we looked at didn't have up-to-date risk registrations applied to their case. So, for example, whether the domestic abuse risk registration was still relevant, or if there'd been any changes or other risks such as risk to children. Next slide, please. So returning back to information sharing, so we talked about this a little bit already. So as we've said, it's absolutely crucial in domestic abuse cases to ensure that any new risk information is known or understood, and that triggers that this triggers appropriate action if new issues are cropping up. So through our second sample, as I outlined, we tested whether practitioners were routinely made aware of any new domestic abuse or other incidents involving people on their caseload. We found that in 61% of cases where the individual had come to police attention, the practitioner knew about it, the probation practitioner was aware. In 10% they didn't, and in a further 29% of cases it wasn't clear whether they knew about it or not. Some areas, as mentioned, had some excellent kind of semi-automated arrangements in place to share information, and where this was the case, we definitely found that the information flow was more reliable and the practitioners were better informed about what was going on with their cases. Relationships with children's social care were problematic, and too often the information that was needed by probation wasn't being received, and often not being requested either, because relationships were poor and there was some sense that people had given up in some cases. So in one PDU, we found that children weren't even being referred into children's social care because the local authority had stated that they required the consent of both parents before they would accept a referral from the probation service. So that is being addressed. There's work going on to address that, we are assured. However, it led to a lot of misunderstanding there and more generally across PDUs about why probation need information, how it would be used, what information children's social care could or should share with them, and often that had an impact on the assessment or management of a case. You can see a quote there on screen from a senior probation officer who described that information is only exchanged after a battle, especially if it's historical information. Possibly they do not understand the probation service's role, but it hinders their and our ability to manage risk. And I think we saw that quite clearly in most places that we went to. Where a person is on their Building Better Relationships programme, so they're attending BBR or a structured intervention, the victim or current partner of the perpetrator can be offered support via the probation delivered domestic abuse safety officer provision, and we'll cover more of that in not the next slide, but it's one that's coming up, so more of that later. Next slide, please. So just following the theme of information sharing, particularly with police and children's social care, this slide shows data from our core inspection programme, so not from the domestic abuse inspection, but from our core PDU inspection programme. And this shows the percentage of inspected cases where we would expect to see inquiries made with the police in relation to domestic abuse and with children's social care about children, but this graph shows where we would expect those inquiries, but they hadn't been made. So you can see there that in some PDUs the percentage is high, some up towards the 70-80% mark, and for far too many, over half of the inquiries that we would expect are not routinely being made. We know that there's some improvements going on around this, that there's staff being recruited into probation regions with the hope that certainly for police, but also with children's social care inquiries, that probation staff will be able to fulfil those inquiries themselves without putting the burden onto other organisations. But recruitment's been quite difficult, and the progress of getting those people into post is fairly slow, I think we found. Next slide, please. So returning to the topic of interventions then, so these are the accredited programmes, structured interventions and the one-to-one toolkit. So as we said earlier, we were trying to understand what proportion of people who should be getting delivery of interventions actually do so. And as we've said, nationally, that question wasn't able to be answered. We requested some data to try and help us unpick this. So firstly, in relation to BBR, we asked for details of people who were given a requirement to complete BBR between June 21, so that was the date of probation unification, certainly in England, and 30th of September, which is when we announced our inspections. That's the significance of that date. So what we found there, that's it, stick with that slide for a moment. What we found there was that there were 6,723 people who were given a BBR requirement during that period. For context, we don't expect that men start BBR immediately, that they're given the requirement. There's often a fair amount of preparatory work to do and taking account of other needs that they maybe have. So we absolutely support that an individualised approach is taken to starting men on that programme to make sure that they are ready and motivation is strong at the point that they start. But as of November 2022, just over 3,000 requirements were recorded as commenced or ongoing. And after other attrition, there was a remaining waiting list of 2,757. Of those, 489, so 18%, had already waited over 52 weeks, so over a year to start the programme, where they may be on a 2-year order to get the programme completed. So time is definitely ticking for those people, and we would question whether they will actually get to start the programme or not. By November 22, 594 BBR requirements had been marked as terminated, so they had finished, and 187 or 31% of those had successfully completed. So of the terminations, just 31% were positive completions. Structured interventions, again, we didn't find that there was national analysis completed to understand the proportion of cases who should be receiving these. So these were largely launched in April of last year, so fairly early days for the structured interventions in some respects. But of the 3 that specifically target domestic abuse, we saw just over 2,000 people had been referred, and 277 had completed the programme at the date we were looking. And the Skills for Relationship Toolkit, so this is a one-to-one toolkit that practitioners can deliver individually with someone on their caseload. Things that we noted about this is that there's no formal quality assurance for the delivery of this intervention. So whereas with accredited programmes and the structured interventions, there is a treatment management process, it's for the individual line managers to look at the quality of work here. The recording around this toolkit was quite problematic, so people weren't always sure how or what to record, which meant then looking at data quite difficult. You couldn't really ascertain reliably whether people were engaged in the toolkit or not. Initially, we know that there was no training available to support practitioners with the toolkit. There are now recordings available to support practitioners familiarise themselves with the materials and how to deliver it. And we saw some good work going on with quality development officers and programme facilitators in some areas who've got that really rich experience of delivering interventions, supporting probation practitioners to become more familiar. So that felt positive, and it seemed to be making a difference in those areas. Of the data, however, we saw that there were 3,700 ish referrals to the one-to-one toolkit. 149 were marked as completed, so it's not a set number of sessions that need to be delivered in relation to this toolkit. Practitioners do have the discretion to deliver the aspects that they think are relevant. But of that 149, we found 26 had actually had no sessions recorded, and 22 had only had one. So there were 2,000, just under 3,000 cases marked as active, and 55 had no sessions. So the recording certainly made it quite difficult to figure out what was going on with those. Next slide, please, Holly. Great, thank you. So overall, we found that people on probation were not always being given sufficient access to interventions, whether that was BBR or the structured interventions or the toolkits. In our main sample, we concluded that 45% of the cases that should have had an intervention had not had access to one at the time that we looked at the case. Positively, we found that where someone was on a programme, there was a good level of contact between the practitioner and those delivering the intervention to share what was going on with that individual. In our second sample, so to remind you, these were the ones who were recorded as having commenced an intervention, and again, that was mainly BBR. So despite these all being marked as having commenced, we found that just over half had had sufficient delivery of an intervention. So themes here included people being very delayed in getting onto the programme for reasons that we couldn't really see or understand. And 21 out of the 83 people had waited over a year to start the programme. And we found in some cases that not enough was being done to enable them to start the programme. Things had gone a little bit quiet and things were being allowed to drift in some cases. So when people attended BBR, they were often very positive about the programme, and I'm sure Chris will say a bit more about this during his part of the presentation. People felt that it made a real difference to them, and you can see some quotes highlighted there. So one BBR participant said, "The way my tutor explained things was brilliant. The way he talked to the group was very clear. The coping mechanisms were spot on. Had I learnt this sooner, I wouldn't have been in this position. He also let me speak and have an opinion, which is important. He was brilliant." So some real praise there for the programme facilitator in that case. Some people felt that they needed more support after the intervention finished to be able to support them in bed changes in their life and kind of keep the materials on their agenda. So follow-up work perhaps with the probation practitioner that needed improvement there. We found that there was some confusion among practitioners about what they should or could be delivering, and particularly where the PDU that they were in was under red or amber arrangements. So some practitioners were under the impression that because they were in a red area that they shouldn't be delivering interventions, and some felt quite uncomfortable about that and how they would be viewed as a practitioner if something then went wrong with that case. So again, you can see on screen there, one person said, "We're not supposed to deliver the toolkit due to workloads, but I'm worried about how it would look if there was an SFO, a serious further offence, and I had not done anything." So practitioners just feeling a little bit confused about what they should be doing in some difficult circumstances. Next slide, please. Thanks. So this slide talks about information sharing with other people who are working with victims of offences, or new partners in some cases of those who are known to commit domestic abuse offences. So in addition to sentence management, the probation service is responsible for 2 services to support victims: the victim contact scheme, which is delivered by victim liaison officers, and the domestic abuse safety officer service, so they're often referred to as DASOs, that is delivered by probation too. So victim liaison officers offer contact to victims where the perpetrator of their offence is sentenced to prison sentence of 12 or more months for a violent or sexual specified offence. They can provide key updates on the stages of a prisoner's sentence and refer victims to sources of emotional support. In our case inspection work, we found that in the 8 of the 9 cases where there was a victim liaison officer involved, so just a small number of cases actually met the criteria for the scheme. But in 8 of those 9 cases, we found that there was sufficient contact throughout the sentence between the practitioner and the victim liaison officer to ensure that changes were communicated. For example, that then allowed the victim to request specific licence condition or to offer them additional protection when someone was being released. The domestic abuse safety officers support victims or new partners of men undertaking the BBR programme or some of these structured interventions. Only 15 of the cases that we looked at in our main sample met the criteria for the DASO service, and of these, 1 declined to engage with the service. So of the 14 cases where victims or new partners were open, we assessed that there'd been sufficient contact during the period of supervision in only 6 cases. In some, there'd been no contact with the probation practitioner at all to the DASO. Issues that we identified were that timely referrals were not always being made to the DASO service, which led to missed opportunities to offer support and safety planning early on, which the DASOs told us often was the key to whether victims were more likely to engage or not, if the timing was right for the first contact to be made. We also saw cases where important relevant relationship changes had been missed due to insufficient contact. So something had happened between the domestic abuse perpetrator and a victim that was known by one party but not known by the other. So important opportunities to support not always happening. In addition to the probation delivered services for victims deemed at high risk of harm, they will be discussed at MARAC, the Multi-Agency Risk Assessment Conference aimed at supporting and safeguarding victims of domestic abuse. So they're often supported by an IDVA, an independent domestic violence advisor. They're asked to support the victim and develop safety plans. They're often employed by third sector organisations independent of statutory agencies, and they provide risk assessments to identify a victim's level of risk and abuse and represent their voice, acting as their advocate in some of the meetings that may take place. There are other third sector organisations who also support victims who are not at that high risk level as well. So there may well be IDVAs or equivalents involved with victims that are not assessed as being a high risk. We found probation practitioners have very little contact with IDVAs. So in 12 of the 15 sample cases where there was an IDVA, there hadn't been sufficient contact with them. And in 7 cases, it was unclear whether there'd been any liaison at all. Practitioners seemed to lack knowledge about the IDVA service, and they were unclear about the boundaries of information sharing or how appropriate it was to share information or even to hear information from the IDVA, who, as we said, will be completing their own risk assessment, which involves a really in-depth discussion with that victim and some of which they would be able to share with the probation service, but that wasn't routinely taking place. And touching on the subject of disclosures, so practice around making disclosures varied quite significantly. So this is likely to take place where somebody on probation starts a new relationship perhaps, and that new partner is felt to be at risk from that person, and therefore consideration needs to be made as to whether they should receive some information about the fact that their new partner is a known perpetrator of domestic abuse. We found that in some cases the practice we saw, we used the word dangerous, we felt it to be dangerous. Where cases were current to MAPA or MARAC or were referred to the local domestic violence disclosure scheme, Clare's Law as it's often referred to, multi-agency decisions were made about whether disclosure was needed, and if it was, what the content should be and what the wraparound support for the person receiving the information should be. Our concern really centred on where those disclosures were made outside of those forums, and we couldn't find evidence of a systematic approach to considering how that disclosure should be made, who should do it, what should be told, and again, what follow-up support should be available to that person. So we heard examples where practitioners have provided information to new partners during telephone calls where the person on probation was present at the other end of the phone with their new partner. So a practitioner in that case had no ability to manage the aftermath of that disclosure or what that may mean for the person receiving the information. In other cases, practitioners told us that they'd shared police intelligence with new partners without consulting police colleagues to gain permission to do so. And at the time of our inspection, we felt that the national guidance that was being provided was not sufficient to support decisions or delivery adequately. So practitioners themselves expressed a range of views about disclosure, some stating that they really didn't feel it was part of their role. They felt quite uncomfortable about giving people that they knew very little about information, sensitive and personal information. And others told us that they routinely shared information, didn't feel the need to consult their managers or think about the content of the information. They just told the person. So in some of the cases where the probation staff had made a disclosure, we found little or no evidence in some cases that the vulnerabilities of the person receiving the information have been considered, or as to what services should be engaged to support them. So we absolutely agree that where perpetrators of domestic abuse start new relationships, efforts should be made to safeguard their partners, but this needs to be carefully considered to ensure that the information being shared is proportionate to the risks and doesn't unintentionally increase the risk of harm to the person that started a relationship. So in our view, except in exceptional circumstances, probation practitioners should not make decisions about disclosures or the content of the disclosure without the input of the police or other specialist services. And we know new guidance was issued early in June that's addressed this issue and changed the practice. So we're pleased to see that change, albeit we know that does increase the burden on the police forces locally to make these disclosures, but it felt like a much safer practice when it is done that way. Okay, next slide, please. So to finish this part of the presentation, this is just a summary of our recommendations that we made. We made 13 recommendations in total to different parts of the probation service and HMPPS, and we know some of these are already being addressed, and some of the issues have been recognised even before our findings were shared. So just to briefly cover these, this isn't the exact wording of the recommendations, it's just a summary, or else it would be a number of slides long, but we've made a recommendation that there should absolutely be a domestic abuse strategy for the probation service that clearly sets out the work that's intended. We've recommended that there is focus on intervention delivery. This needs more careful monitoring at a national level. That the probation service needs to absolutely accurately identify victims. So that's not just victims of the index offence, but those that may be at risk from the perpetrator through other relationships and connections. We've recommended that all staff use the domestic abuse policy framework and dip in and out of it depending on what the nature of their work is. We've asked that the demand management decisions, so the prioritising probation framework for sentence management, that is managing the demand management process, and it says there doesn't unintentionally prevent important partnership working. So some of the things that we saw happening is where resource was scarce, that the probation service retreated from some of the partnership working, and we want to make sure that important work isn't lost. Recommendation around improving disclosure practice, and to some extent that has been addressed through the new guidance. We know the police information sharing agreement is being reviewed, and we hope that review will indeed close that loophole. That means if there's no known history of violence, that probation practitioners can't get access to information. We haven't really talked about it in this presentation, but we've made recommendations about the improving the training for the domestic abuse safety officers. There is a big review ongoing around that work, and we hope that there's some standardised training comes into place to ensure DASOs are really equipped to do their work. We've recommended that the probation service engage to develop multi-agency training and awareness to really benefit and learn from those expert organisations that are out there who understand the world of domestic abuse in great detail. And there's a lot that probation can learn from those agencies. We've made a recommendation around improving information sharing arrangements with not just police but children's social care services also, to improve the quality of domestic abuse assessments and use of specialist tools. So the SARA, if that is the chosen tool of the service, that it needs to be a meaningful completion when it is used. And then finally there, to ensure clarity of roles and responsibilities between programme teams and probation practitioners, who's responsible for what during someone's sentence and what information should be shared and when. So that concludes the findings of the report. I'm going to come back to you shortly and talk about our effective practice guide. But in the meantime, I'm going to hand over to Chris Parnell, who's a research manager from User Voice, who supported us with this inspection. And Chris is going to tell you about their work. Thanks, Chris.
Thank you, Noreen. So as part of User Voice's relationship with HMI Probation, over 2,500 people have had their voice heard as part of both regional and thematic inspections over the past year. The relationship between the two organisations continues to grow as thousands more will have their voices heard in the years to come. But today I'm going to speak through some of the data that represents the voice of people on probation for the inspection into domestic abuse. Our full report titled, Supporting Perpetrators of Domestic Abuse for Better Outcomes is released today to coincide with this event. This report goes into much more detail about the findings and has many direct quotes from people on probation. Next slide, please. Thank you. So in total, we spoke to 55 perpetrators of domestic abuse through semi-structured interviews. We found access to participants for this consultation fairly difficult given the nature of the offence. So in the end, we're happy with the amount of people that took part. The overall objective was to better understand how the probation service is supporting perpetrators of domestic abuse and how if the service meets their needs. And then furthermore, our objectives were to understand what support people have or haven't had, both in general and in relation to their offence, to understand the effectiveness of intervention programs in reducing reoffending and helping rehabilitate participants, to collate people on probation's views of what probation needs to do to better help others in their position, and to highlight any good practices that could be built upon by the service. Next slide, please. So we found great variance in regard to the effectiveness of participants' probation experience to help them avoid further incidents of domestic abuse. It was clear from the analysis that an individual's relationship with probation staff affected their outcome and perspective. For example, 3 in 4 of those that stated they do not have an effective relationship with probation staff said that they didn't feel supported by probation to avoid further incidences of domestic abuse, whereas almost 2 in 3 people that had a good relationship felt supported with their rehabilitation. This difference was noted across all aspects of their probation experience. As you can see on the right, everybody who stated that they didn't have a good relationship with their probation practitioner did not feel like they got what they need out of their appointments. This can be seen across their entire probation experience, for example, in their ability to access services, in their ability to feel heard by probation, and so on. Next slide, please. The most interesting aspect of the findings for me were people's perceptions of their intervention programs and the impact they had on them avoiding further incidences of domestic abuse. Overall, people had a positive experience, with 67% of people stating that the intervention program experience had a direct influence on them to avoid further incidences of domestic abuse. However, the majority of the 16% that stated they weren't influential said that they rely purely on self-motivation to avoid further incidences. There were 5 key themes that came out in relation to people's experience with intervention programs. The number 1, so intervention programs can be an eye-opener. This is a quote that we heard numerous times from numerous people. They can be an eye-opener and a catalyst for change. Participants report that their intervention program experience has been a driver for a positive change in their mindset. It offered many an opportunity to self-reflect, and very importantly, it gave participants a better understanding of what constitutes as abuse and how to recognize it. So point number 2, people are able to develop vital coping mechanisms through intervention programs. The main takeaway for many was an increased ability to control their emotions, to not be reactionary and make better decisions. In our full report, there is an interesting case study that goes into depth on how a service user that attended the Building Better Relationships program uses these coping mechanisms in the real world. And number 3, insightful and caring tutors foster understanding and improved assistance. So effective and relatable staff resulted in an increased capacity to take information on board and improve the impact of coping mechanisms. This also helped create an environment that the participants wanted to come back to each week. Number 4, a positive group environment leads to an improved intervention program experience. So many people said that they benefited personally from helping each other understand their situations, which then allowed them to understand their situation better. And 5, as I spoke about briefly before, self-motivation is as important as the programs to avoid reoffending. Next slide, please. But although there are clear issues with the BBR intervention program that need addressing by a formal review and a subsequent update of the program, the finding in our report suggests that there is a clear need for programs that are tailored specifically to perpetrators of domestic abuse. At User Voice, all of our work and all our consultation work is always solution-based. On screen are 4 of the 8 solutions that were put forward by participants in the consultation. So number 1, there needs to be in-depth training that involves both people with lived experience and those staff that are noted by people on probation as getting it right. Numbers 2 and 3 are quite similar: to review the methodology and modules via a consultation with people that have completed the course to see what could be improved and built upon. And finally, number 4, many people felt left in the dark after they completed the program, so bringing the language and the learning from the courses into their probation experience and appointments will be beneficial, as it would therefore continue the support once the program is finished. Now, as I mentioned at the start, I'm going to post the link to our full report that's on our website in the chat now, but please don't have a look until after the presentation's finished, because I know there's a lot more important information to come specifically regarding the HMI Probation's effective practice guide. So thank you.
Thanks, Chris. Next slide, please. Great. So I'm just going to very briefly cover a little bit of what's in our effective practice guide. It's published on our website alongside the main report. So our aim of publishing effective practice guides is to provide examples of where we see our standards being delivered well in practice. We create an effective practice guide alongside most of our thematic reports. So you can see on the slide there that our guide contains an introduction, some background, specifically the standards that we looked for in this inspection, and some examples of effectiveness. So these included aspects of leadership, and information flow internally within the probation service, information sharing generally between police and children's social care services. So those areas that we found that were getting it really very right, we've included examples of those. Multi-agency work, we've referenced some of our work from the previous MAPA inspection as well that was relevant to this. Some case management themes, including effective pre-release work, victim safety measures, holistic assessment and contingency planning. With the effective practice guides, people that we've met during our field work kindly volunteered to give up their time and generously agree. Possibly we strong arm them a little bit, but into allowing us to record video interviews with them. So you'll see some of those in the guide. Some of those people are on the call too. So a big thanks again to them. If we move on to the next slide. Thanks, Holly. So the guides follow a similar format each time. So finding your way around, there's some symbols that help you to identify whether they're tools for practitioners, whether they are links to other useful information, other research and pieces of information that we think are useful to practitioners, video interviews that we've recorded, or external videos that we think are useful to this topic. There are questions that can be used individually for reflection, or perhaps in a team meeting or other forums. In this guide, we've particularly focused some attention on exploring what is a relationship. So when probation practitioners are talking to people about, are you in a relationship, what do we actually mean by that, and are we clear that the people we're talking to understand that? And a similar consideration of who are the victims of domestic abuse to make sure that we're broadening out that question as widely as we possibly can. Next slide, please. So just to highlight, there are a particular number of examples in this inspection that we found some really positive practice when we visited Cardiff and the Vale PDU. So what we've included from our field work in Cardiff was the reportable incident scheme. So this is the semi-automated process where people, probation practitioners, are alerted to any incidents that involve people on probation, and then crucially the probation practice involves having to have a response to that. So it may be that no action is needed, but something has to happen as a result of that information being found, which was a really good system, we felt. We've highlighted the work of the Drive project in Cardiff. We saw Drive in operation in several places, but we felt it was working particularly well in Cardiff. So please do have a look at that, because Drive's a really interesting project, and certainly probation and Drive are working really well together in Cardiff, and we may well have people from Drive on the call too. Cardiff would also kind of reached out to a number of organisations and had some representatives from a range of domestic abuse agencies that work in the domestic abuse space kind of coming in to probation to talk about their work, and we felt that was really important and certainly something that we'd be very pleased to see happening elsewhere. And then just finally in Cardiff, we saw some really impressive work by the Wisdom team. So that is an element of the IOM framework in Cardiff, and they were certainly working very well with police and other partnership agencies, crucially with the input from the psychology services to support their work. Hereford, Shropshire and Telford also feature large in our effective practice guide, and you'll see some really good interviews with staff from that PDU who were kind enough to support us with the guide. So that's just a taster for you. If we move on to the next slide. That's a repeat of the previous slide, so we'll move on from that. There we go. So that just gives you the links as to where you can find the main report itself and the effective practice guide. But that's it from me. So thanks so much for listening, and I think we've got time for some questions now. Justin.
We have, Noreen. Thank you very much, Noreen, for a very clear presentation, and to you, Chris, as well, for some really interesting findings from your interviews. Many thanks to Holly and Kevin for their help with today's event as well. And can I just also say thank you to Tammy Burrows, who I know is in the audience and helped out with the effective practice guide as well. So yeah, please do put your questions in the chat line, or raise your hand if you'd like to ask them in person. We had a couple earlier on that I might start off with. So Viv Bickham, you posed the question. It seems a contradiction that people that we interview, practitioners we interview, felt they had sufficient training and I think also supervision, yet clearly the case data shows real gaps in the assessment of risk. And obviously problems with workloads. What can the service do to enable them to manage risk that's relevant to domestic abuse better than they are at the moment, Noreen?
Yeah, I think we shared exactly your concern that is a contradiction. So I think partly what might be feeding into this is that there are a lot of new probation practitioners who, having attended the online or e-learning around domestic abuse, felt that they had received the training that the service expected them to receive to be able to work with these cases. And I think the depth and breadth of that training probably isn't sufficient to equip them, hence our recommendation for some broader training that really helps people understand the issues of domestic abuse in a more in-depth way. Obviously workloads, as you've said, hugely impact on what people are able to do. Also, certainly where we saw smaller caseloads, for example, the Cardiff team, we mentioned the Wisdom team, often in IOM teams, they have a smaller caseload and we do see better quality work. So we would hope that those things are considered, and where people have caseloads that carry a lot of domestic abuse cases within them, that thought needs to be given to what is a realistic amount of people that they should be managing at any one time.
Thanks for that, Noreen. Kyle Hart, you asked, did you look at Commission and Rehabilitative Services, CRS services, Noreen, for family and other relationship work in this cohort? What did the completion or referrals look like for that?
Yeah, I think we tried. There wasn't a lot of information around, and actually, when we split down the pathways, it was difficult to get the data on exactly who had been referred to the very specific family and significant other pathways. So we focused more on the interventions that were being provided by the probation service. We certainly looked at CRS provision in our core inspection programmes, but we just weren't able to get a really clear picture. Certainly practitioners weren't really talking a great deal about, well, I've decided not to deliver this toolkit because I've referred into that service, for example. So it was quite quiet on that front, I think, in the cases that we saw.
Thanks, Noreen. And Daniel, you make the point that probation does need a better referral system for structured interventions that perhaps mirrors the referral tool for CRS services. It feels like a pretty clunky process for making those referrals at the moment. I think there was a question about follow-up support for men on BBR, which I think, Chris, came out of your interviews. I don't know, Chris, whether people talked about what follow-up support they might have liked after they finished BBR. I think from memory, some of your people were saying they ended up giving it to their fellow participants themselves.
That's correct, yeah. So there was one group after the intervention program that didn't feel that they're getting the support they needed from probation, and they ended up making just a WhatsApp group to provide support to each other. So I think it's also in the case study that's in our report is that maybe it's to receive some links or a leaflet with organizations outside of probation that could help support them further. So I think that's a good idea. But then just bringing aspects of the course also into their appointments too, and just routinely asking about maybe the coping mechanisms and
yeah. Noreen, did you have a view on that?
Yeah, definitely. I mean, I think Nicole, who asked the question, is an expert on BBR, so I'll be careful what I say, but it's good to see you on the call, Nicole. I think that we expect that there's follow-up work from BBR, and certainly I think, as Katie said there later on in the chat, that there was a manual which should set out post-programme work. So some of this speaks to the recommendation that we made around roles and responsibilities between programme facilitators and practitioners, about actually knowing kind of what has been done, what needs follow-up, and trying to keep those materials alive for people in the follow-up period. Certainly, and again, I won't name the programme facilitator, but anyone from Wales or Cardiff PDU will probably know who he is. He had sort of set up a bit of a post-programme support thing himself, so it's outside of the BBR kind of manual, but recognising that gap, and that a lot of the men maybe sometime later, even after they finished their order or license, may feel the need to talk to somebody about this. So I think he had been also talking to some of the local support services about whether probation could kind of skill up those advice lines, really, so that if they could direct people to those advice lines or helplines, and they would have some understanding of what BBR means and what those men had been through, in order to allow them somewhere to go in the future if they needed a further conversation. So the pockets of really interesting and important stuff happening, but it's not generalised.
Thanks very much, Noreen. Paul Witherston says, do you think it will help improve the disclosure position now that probation are, to all intents and purposes, unable to do disclosures themselves?
Hi, Paul. Good to see you as well. I think it will be safer. I think that's the most important thing. I mean, I think certainly there are challenges. It will be some police areas, I'm sure, will have concerns about all of the disclosures having to come through the DVDS process, the Clare's Law process. But some of the practice we saw was really worrying, and no thought to the vulnerability of the person receiving that information, no knowledge about whether they had learning difficulties, whether they'd been a previous victim, and what may happen to them afterwards. So probation, with the best will in the world, alone cannot know that stuff. Police or other wraparound services may have more information that can feed into making a safe and sensible decision. So improvement in terms of safety, yes, I would hope so.
Thanks, Chris. I don't know if any of the people you interviewed had feedback on how Clare's Law operated, or what that had felt like from their position.
I don't believe so, no. I don't think we have any data on that.
Katie, you asked, is there still an offender management manual for managing people on BBR? There used to be one. I think, Noreen, you said that there is still one, is that right?
Yeah, I think there is. Some of the materials around some of this stuff are quite old, but yeah, certainly if I think back to my practice days, there was definitely an expectation for post-programme work. But again, it seems to have been a little bit lost. And as I say, hopefully that recommendation around clarifying roles and responsibilities of programme facilitators and practitioners and how any kind of post-programme plans are being followed up should be really integral to what the practitioner goes on to deliver. But we didn't see a whole lot of that happening. So whether there's a manual that says it or not, it's necessary.
Excellent. Jeffrey Clough, you say of the 134 domestic homicides in 2022, how many perpetrators were subject to an order or license? I think we have in the key facts at the beginning of the report, we say that I think it was the year before 2022.
Correct. Yeah.
There were 12 serious further offence domestic which involved someone on probation committing a suspected domestic homicide. So that was the number on. Is that right, Noreen? I think that was the number, wasn't it?
Yeah, I think that's right. They're not the same year, but the numbers don't vary too dramatically. But if you look in the key facts at the start of the report, that's given, and the various explanation of that data and where we obtain that from is there too.
Thank you. Tracy Bowman says access to accredited programs in custody is poor. BBR only available in a handful of Cat C prisons. Do you think this report will aid a push for investment in domestic abuse programs in prisons? We also need a more structured referral process for BBR and Kaizen in prisons. It is very difficult at present due to the need to transfer to a prison running the program. Feels like time in custody is wasted as the men are not accessing domestic abuse interventions.
Yeah, we didn't focus on our scope for this inspection was work in the community, but I don't doubt that what Tracy says is a real challenge, and absolutely we know that there's some interesting things starting in terms of addressing domestic abuse in prison. So HMP Swansea, the drive programme is starting there, so to address just that, men getting short-term sentences that don't usually have the opportunity to do anything to address domestic abuse issues. So there's some interesting work going on there, but I couldn't comment specifically on delivery of programmes in prisons. It wasn't in our scope, but certainly using time well in prison and preparing for release and the flow through from what goes on in prison to the community is really important.
Thanks, Noreen. Carl, you note that previously probation officer training did involve training in knowledge about interventions and programs, but not anymore for current PQIPs. Do you think programs training for PQIPs needs to be added to the current training curriculum?
Yeah. If I answer that question personally, absolutely yes. Having been someone who delivered ETS to a DRR group, I'm sure some people will know how challenging that probably was. But yeah, certainly the current newer practitioners coming through know insufficient detail about programs, I think. So not just in terms of the content of the program and what their caseload will be going through when they're on the program, but actually what the group looks and feels like, kind of to being able to support them to be motivated and to be prepared and equipped to go through that group work program. But also then it flows out into things such as the toolkit use that we saw. So a number of practitioners told us that they were just quite worried about delivering an intervention because they'd had no experience of doing so. So despite the fact that the toolkits were designed to be pick it up and use it without having detailed training to be able to do so, they were quite worried about how they approach that. And again, you've got some interesting things going on in some places where you've got someone who's an ex-programme facilitator in a team. They were kind of acting as a Spock and supporting their colleagues to roll out and get used to using those programmes. And some areas I think are now putting PQIPs through a kind of a short placement in the programmes team. So even if they're not delivering programmes, which I think is a really worthwhile, and it's some of the some of the best training in probation that I think there is the program facilitation training, but at least they can get a sense of what a group feels like in order to help the people that they're working with prepare for it. So yes, I don't know what the inspectorate's view overall is, but my view is that it would be really worthwhile, and it adds massive value to how well people can talk about offending and address it.
Thanks, Doreen. I was in the Southwest region yesterday, meeting with their probation, with their programs team, and they said exactly this point, that they have decided to offer PQIPs an initial placement with the programs teams. I think they got 14 PQIPs. They said their first placement would be with an intervention team, not with the intention of keeping them there on a permanent basis, but they then go back into sentence management with the knowledge of the programs, which, like you're saying, I think would be a very helpful thing for them to have.
Yeah.
Let me just find some other questions. We find a lot of people who commit domestic abuse related offences go into prison for short sentences, and therefore the prison does offer programs, they won't be eligible due to the short sentence. Are there plans to look at domestic abuse programs for those on shorter sentences? The impact and trauma on any victim is huge. I mean, yeah, I'm interested in people being released on licence from short sentences. Do you get the impression they get any interventions, Noreen?
Theoretically, the structured interventions or the toolkits could be used with those people, because there's often less of a waiting list, and the delivery is not as long as BBR. Obviously, you need a good number of weeks, months to be able to deliver BBR. But certainly, I share the concern. I think those people, short sentences are disruptive for a number of reasons, not least that people coming out will be on licence probably for a period of time, and then PSS, which has less controls on it in terms of restrictive conditions, etc. But yeah, as I mentioned, there's some interesting things going on in some places with the Drive project going into HMP Swansea specifically to address those kinds of cases, the ones that go in for a short period of time and traditionally would get very little in terms of intervention. Drive will work with them in prison and then follow them throughout into the community, which is really promising. So that we felt was a really good example.
Thank you. Important question from Leslie Took, who says, did the inspection look at how many practitioners were PSOs or POs? CRC inspection probably highlighted the many domestic abuse perpetrators who are low and medium risk, who are then usually allocated to a PSO who has less training in working with domestic abuse perpetrators.
Yeah, we certainly did note that. I can't tell you off the top of my head what proportion was which, but feel free to drop me a line and I'll answer that by having a look at our data. But certainly, yes, and we have various things about allocation culture in terms of PSOs holding domestic abuse cases. So in some areas we were told that yes, kind of run of the mill, they would be allocated them. Some it was only after they'd completed certain training, and some it was only after they'd completed certain training and had been deemed competent by their manager to hold those cases. But over the years the boundaries have certainly shifted. Domestic abuse used to be an absolute no for PSOs, but that certainly isn't the case now, and we certainly did see POs and PSOs managing cases. We also found some cases where the case was being held by a probation officer, but a PQIP was doing the bulk of the work, and sometimes we had concerns about how much oversight there was from the probation officer in that case. They were being kind of held in name only, but the PQIP was certainly driving the case, and often without the knowledge or experience that we would hope to see in place for someone working with that level of domestic abuse risk. So yeah.
Thanks, Laurie. Lots of positive comment in the chat about the value of understanding accredited programs and training in accredited programs for people involved in sentence management. Sue McCauley asked, there is a wealth of interventions delivered by both probation and CRS providers, but is the evidence base properly established for these? Is there research on their effectiveness?
Sorry, I dipped out there for a second. Could you repeat which one that was, Justin?
Sue McConnell was asking is there a proper evidence base for all of these different interventions you've been talking about, and is there research on their effectiveness?
Yeah, interesting questions. So the evidence base is largely drawn from the same place for each of the interventions. I think whether they have been tested or research on effectiveness, BBR hasn't been evaluated in the way that it was originally intended to be, and our understanding is that now isn't planned to happen. I think Nicole Renahan is still on the call, who has done a lot of research into BBR together with another couple of colleagues, but they haven't been. We've certainly not seen evidence of the particular interventions being researched more, that the evidence base is felt to be effective that have gone into them, but some of them very new, so they haven't been fully evaluated yet. But BBR not evaluated, and no plans for it to be.
Thank you very much. We're getting more comments coming in around disclosure and varying opinions about taking probation. Well, the sort of reforms and guidance that have come out. Daniel saying, can't help think, but the excessive caseloads, rapid staff turnover, introduction of large numbers of new and less experienced staff has not been conducive to sensible and considered disclosure practice. But he says the revised disclosure guidance doesn't necessarily offer any kind of solution either. Rather, it seems to be a response to accommodate poor probation resources and reduce staff confidence. Wouldn't it be better and safer all round to work towards better resourcing and upskilling of probation practitioners to make informed disclosure decisions?
Yeah,
I guess they're not either or. We do certainly need more resource in this area.
Yeah. I think just to clarify, the disclosure guidance, changing guidance didn't come about because of us. It was already in train before we started this inspection, and I understand that there is there was no legal basis for probation to be making the disclosures they were. So that decision wasn't made, from my understanding of what we were told. That wasn't made on the basis of poor disclosure practice. It was made on the basis that there wasn't a legal basis for making it in the first place. For me, I think the practice, whoever is making it, it needs to be multi-agency. It needs to be discussed, and as much understanding about the person who is going to receive the information needs to be made too, in terms of as I say, kind of, their ability to take on board what they're being told and what support they may need. Are they already involved with other services, for example? There may be a better placed person to make a disclosure if they're already working with a social worker, for example. But yes, so the changing guidance isn't down to us or our criticism. It was entirely separate. So I understand there's other challenges about probation making these disclosures. I can see Mark's expressed similar concerns too. Yeah.
Thank you very much, Noreen. I think we're nearly out of time, so I did just want to allow time to thank you, Noreen, for a great report and a great presentation. Likewise to Chris for an excellent report from User Voice and a presentation. Links to both of those are in the chat line and on our website. Can I again thank Holly and Kevin for their help with today, and Tammy for help with effective practice. And I can thank everyone in the audience for dialing in, particularly thanks to those of you in the audience who have helped with this thematic, either being a fieldwork area or helping with interviews for our effective practice guide. We can't do these inspections without the cooperation and help of all of you working in probation or in other agencies. So we are very, very grateful to you for that. I hope you've all found this an interesting session. I certainly have. If you haven't yet read the report or the effective practice, do go in and have a look for more information. But thank you all very much and enjoy the rest of your days. Thank you.